So, my initial interest in medicine didn't start as a result of one or two experiences, but rather my interactions with my pediatrician over time in my childhood. And that interest continued to grow as I pursued healthcare opportunities. Now, initially, I had a fear of medicine. I used to see the physician as an antagonist. I would dread going to the pediatrician's office, be terrified of getting booster shots, of getting vaccines because I remember how much pain they brought me. Eventually, that started to slowly change over time because my pediatrician was able to teach me about why vaccines, why booster shots are necessary, and why I shouldn't be scared of them because they're here to help me in the long run. Now, over time, my pediatrician also connected with me. He began to understand me. He kind of served as this role model or mentor in my life because he taught me about my health and how to live healthier. He taught me why I shouldn't drink a lot of coffee, eat a lot of chocolate every day, things like that that got me interested initially. As a result, throughout the ensuing years, throughout college, I sought out opportunities to learn more about healthcare, learn more about medicine. And as I worked as a medical scribe, as I shadowed, as I volunteered in a free clinic, and as I participated in different healthcare venues, that my interest continued to grow, especially when I saw patients and how their quality of life was improved when they saw the physician after a few visits. For example, a patient might have come in for a really bad back injury or a really bad rash, and I could see how stressed out they were, how vulnerable they were. But with the physician's help, with their, worth working with the patient, with come up with a treatment plan, within a few visits, they'd return and their demeanor would be changed drastically for the better. And I thought, wow, this is just seeing that quality of life improve for the patient. I was like, wow, this is it. This is what I want to do. This is what makes me happy. And I also began to see the physician as not only a healer, but also an educator. Because I also developed an interest in teaching throughout undergrad and my gap years, I also saw medicine as a way to take my abilities and interests as an educator and bring them to medicine, because I saw physicians as not only healers, but also great teachers because they taught their patients. And I saw that when patients were taught, they felt a lot more confident, they felt more in control. They felt as if they had the building blocks to take an active role in their care. And for those reasons, I also want to become an educator in the healthcare setting and complement my role as a physician by hopefully improving health literacy for not only individual patients, but also the community at large. With all these things in mind, with all these experiences, I'm continuously motivated to become a physician. And I'm also reminded of why I want the privilege to eventually provide longevity to patients one day.